Okay, so hello viewers, and a lot of questions have been coming about hair fall and hair loss and how homeopathy and other therapies can help, and that's why I thought of making this video with one of my friend and colleague, Dr. Jignasha, and she is a cosmetologist. So we will be talking about how homeopathy and other therapies can complement each other in helping in hair fall, hair loss, and such kind of issues, especially in females. So, Dr. Jignasha, maybe you can talk to us a little bit about what are these symptoms often of hair loss, hair fall, and how do you actually analyze them?
Right. So basically, since we're talking about females mainly to begin with, now there are two things. One is the hair shedding, and one is hair thinning. Hair shedding in technical terms is called as telogen effluvium, and thinning is female pattern hair loss, as we see, where generally there's thinning of the vertex area of the females, and so these are the two different types. As far as the causes are concerned, we can talk about the causes to begin with. There is stress, as cliche as it sounds. Stress to begin with. It is also physical. It could be emotional. Physical. It could be in terms of any kind of surgery or any long, illness, any fever of any kind which has been for a longer duration. Emotional could be loss of a loved one, going through a divorce, or some loss of a job, some major change in life basically. Second, there's nutritional deficiencies, hormonal, which is thyroid, there is PCOD, there is postpartum, that's post-pregnancy hair fall, certain antihypertensives and certain antibiotics also lead to hair loss. So yeah, these are the causes. A certain weight loss and a fat diet, crash diet as well.
So this is very interesting because when we were discussing about the collaboration, how holistic health can be worked on, I was talking to her about how these causes have a direct connection in our homeopathic literature. Dr. Jignasha is also homeopath, and she's doing this cosmetology. So we were just discussing about this, that the commonest causes that I was seeing in my practice very often, because I see patients here and I also see online cases of Indian patients and patients abroad. So one of the commonest things were ladies coming with hormonal issues like polycystic ovarian disease, endometriosis, infertility, and other health issues. And typically at a deeper level there has been a deeper issue of stress,
right?
And the idea is that at a superficial level we can do a lot of things, but somehow we have to go at a deeper level and understand deeper patterns and work on them, because that itself will help heal much external and superficial issues.
Absolutely.
So along with that, the other commonest causes that Dr. Jignasha also spoke about was thyroid. So there are homeopathic remedies I was talking to her about. For example, one of the commonest remedy that we use in polycystic ovarian disease very beautifully is folliculinum. When we see a lot of hair fall in polycystic ovarian disease with a deeper pattern of lot of history, of lot of domination, either of parents or of in-laws or of husband, a lot of feeling of domination and feeling under a lot of pressure and choking under pressure. One of the top remedies which I use is folliculinum. A lot of patients of mine of polycystic ovarian disease have been improving with this, and in thyroid as well. Commonest cause of hair fall in my practice that I see is thyroid. It's also because I see a lot of thyroid cases.
Right.
And thyroid is another topic. I've written a book on it. And even in thyroid, it's very important to know how did the thyroid start, when, what age, because some people, the thyroid starts at the age of puberty, so the remedy is calcarea iode hydrastis. If it starts during pregnancy, the remedy is different. If it starts after grief, the remedy is amyl nitrosum. So it's very interesting to understand the exciting factor how it started.
Also genes play a major role, genetics. So I'm sure the treatment changes as well. So hair fall, hair thinning, not hair fall, sorry, but hair thinning is also majorly associated with genetics. So yeah.
Another commonest thing that I was also talking to you about is after any major illnesses for a long time. So I was talking to you about one of the case which I was treating, history of a lot of fever, and after fever the hair fall started. And there are few remedies here. Fluoric acid is given by phosphoric acid. So beautifully, these acid remedies can help. And after pregnancy, postpartum hair fall issues also, one of the remedies is Kalium carb, Kali carb also helps. So understanding the cause and going to the exciting factor, and very importantly understanding the deeper patterns can help a lot. Maybe here you can also share, Dr. Jignasha, how nutrition plays such an important role, and how sometimes as physicians we may not look at that aspect, and some nutritional suggestions to patients can make a lot of change. Maybe you can share here.
Right. So that's the reason when we take history, as I said, taking a case in detail is very important, because you actually find out the root cause. So for example, if there's a nutritional deficiency, it's B12 or D3, iron, ferritin, obviously we give supplements for that. And as far as hair again is concerned, I think protein, having good amount of protein is very important, because your hair is made up of protein. Good carbs, having good amount of omega-3 in your diet, good raw vegetables, fruits, green leafy vegetables, all these things play a very important role. Of course, as I said, the genetic factor in some cases would be there, but having a healthy diet would just push it to further by a few more years if you're eating well.
So also you suggest supplements to some patients?
Absolutely. If there is a deficiency, hence we always ask the patient to do the blood test. And of course, most of the times I think B12, D3 is very low in most of the patients nowadays. So and the impact is definitely seen on the hair. So we definitely give supplements for that. And as far as diet is concerned, I think vegetarians are generally low in B12. So yeah.
That's more or less. So the other thing that I was talking to is the amount of in a cosmopolitan city like Mumbai, almost every third girl or woman has polycystic ovarian disease or endometriosis or certain hormonal issue, and that is why how commonly it's connected to hair fall. And here it's important to not just understand the menstrual symptoms as a homeopathic point of view, but also here I give a lot of importance to the state of mind. And state of mind is not only about whether how the person's nature is or how the personality is, but we have to understand the basic deeper patterns. We have to go at a deeper level, understand the patterns. And these patterns are not something that just come up randomly, but they start from the childhood. How the childhood has been, how the traumas have been, how they have reacted in different situations, how is their perception of reality, how their dreams have been, how their fears have been, how have they reacted in the most difficult situations in their life. And here very often in my practice I've used mammal remedies a lot, like caninum, like defloratum, like asinum, like equinum. These are very, very important mammal remedies, especially in these cases I've used interestingly more often than not. So I just wanted to share that. The other thing that I wanted to ask you is, in many of my cases where we are helping with homeopathy, in certain cases, in certain complicated, obstinate cases, maybe there can be role of other therapies to collaborate, to complement each other, because the world and the medicine is now going towards holistic science, where 2-3 different fields can work together to help patients. So what are the treatment possibilities that you offer in that way?
So as you rightly said, I think homeopathy can be a great adjuvant for these kind of treatments. For example, we have for hair thinning, for that matter, we have something called as mesotherapy, which is artificial cocculation of vitamins and minerals which we put into the scalp using a derma roller. A derma roller is a roller which has like tiny minute micro needles, which we just roll all of the scalp. So that helps in irritating the dormant follicles beneath and improving the circulation, hence improve in your thinning and fall. There's also something called as PRP, which is called as platelet-rich plasma. There, as a homework, we give certain applications and supplements, as I said. So this is what the treatment is, and as I said, in really difficult cases, we can definitely collaborate and
absolutely. So it's very interesting what she spoke about PRP, etc. And we have the homeopathic parallel to it also, sarcode. So we have remedies prepared from ovaries, uforinum. The remedies prepared from testosterone or testes actually. We have remedies thyroid and prepared prepared from the thyroid gland of the sheep. So it's very interesting how we can use sarcodes in many of these cases. Anyway, so it was great actually talking about this because of the questions of the participants. I think we can collaborate further,
Right.
and if patients or students, whoever want to refer their cases, they can write to us. We put our email IDs down, and we can collaborate in some of these difficult hair fall cases and help few patients.
Absolutely, absolutely. So, thank you.
Thank you.